Hello viewers, welcome to the Learners Nursing classes. As demanded, today the topic is National Immunization Schedule. So without delaying, let us start this topic. In the National Immunization Schedule, what all vaccines are covered, I will be talking about that, and the doses, site, route, and little about the vaccine. So at birth, BCG is given. BCG is Bacillus calmette guerin. It is given intradermally 0.1 ml on the left upper arm. Now why it is given on the left upper arm is so that this vaccine forms the scar. So when it is forming the scar on the left upper arm for the mass population, all the generation, then whenever we have to check the immunization of status of the child, whether the child is vaccinated for BCG or not, we will check the left upper arm for the scar, and then we will come to know, okay, the child is already vaccinated. Now BCG vaccine comes in the freezed dried form and it is dissolved in normal saline and it is given intradermally. It is a live attenuated vaccine. Now what is the live attenuated vaccine? Live attenuated vaccine means डिक्रीजिंग दी वायरुलेंस ऑफ दी पैथोजन, मतलब कि बीमारी पैदा करने वाली क्षमता को कम कर देना, एंड देन we are giving the viable vaccine that is called as live attenuated vaccine. Now coming to OPV. OPV 0 dose, oral polio vaccine, 0 dose, given orally, 2 drops. Then coming to hepatitis B birth dose. Now hepatitis B birth dose is given intramuscular and it is given 0.5 ml. So whenever intramuscular injection is given to a baby, it is given on the anterolateral side of the mid-thigh. So hepatitis B birth dose, जो ये जो वैक्सीन है हेपेटाइटिस बी वैक्सीन, इट इज़ अ रिकॉम्बिनेंट डीएनए टेक्नोलॉजी से बना होता है एंड इट इज़ अ किल्ड वैक्सीन. नाउ नेक्स्ट कमिंग टू दी वैक्सीनेशन एट 6 weeks. OPV oral polio vaccine dose 1, route oral and 2 drops are given. Now coming to rotavirus vaccine. See, rotavirus vaccine 1, it is an oral vaccine. It is 5 drops which is given orally and it is a live attenuated vaccine. नेक्स्ट इज 6 weeks में पेंटावेलेंट देते हैं. पेंटा वर्ड्स मीन्स 5 एंड पेंटावेलेंट में 5 वैक्सीन कवर होती हैं. नंबर 1 इट इज़ DPT, दैट इज डिप्थीरिया, पर्ट्यूसिस एंड टेटनस. तो ये 3 वैक्सीन हो गई, प्लस हीमोफिलस इन्फ्लुएंजा वैक्सीन, एंड देन कम्स द लास्ट इज हेपेटाइटिस बी वैक्सीन. तो इसमें क्या होगा, पेंटा 1. तो पेंटा 1 में DPT का फर्स्ट डोज, ह्यूमोफिलस इन्फ्लुएंजा का फर्स्ट डोज एंड हेपेटाइटिस का फर्स्ट डोज. इट इज़ गिवन इंट्रामस्कुलर 0.5 ml एंटीरोलेटरल साइड ऑफ मिड थाई. ये जो सारी वैक्सीन हैं ये नेशनल इम्यूनाइजेशन प्रोग्राम में है. दीज आर फ्री फ्रॉम द गवर्नमेंट. नाउ कमिंग टू न्यूमोकोकल कॉन्जुगेट वैक्सीन, दैट इज कॉल्ड एज PCV. इसको प्रेवेनार भी बोलते हैं, इसके बहुत सारे स्ट्रेन्स भी होते हैं. नाउ दिस इज गिवन इंट्रामस्कुलरली 0.5 ml एंटीरोलैटरल साइड ऑफ द थाई. Then coming to FIPV1. FIPV1 is fractional injectable poliovirus vaccine. It is given intradermally and it is given 0.1 ml on the upper arm right side. Now coming to the 10 weeks, when the baby is 10 weeks, the OPV second dose is given. See, OPV 0 dose was given at birth, then at 6 weeks the first dose was given, and now at 10 weeks the second dose is given. Now 2 drops orally it is given. Then now rotavirus. Rotavirus, I told you, it is a live attenuated vaccine and it is given orally 5 drops. Then comes pentavalent second dose. Pentavalent, again 5 vaccines are there: diphtheria, pertussis and tetanus, and hemophilus influenza and hepatitis B. So all the vaccine have got the second dose, intramuscular 0.5 ml anterolateral side of the thigh. Then coming at 14 weeks we give OPV 3 oral dose 2 drops. Rotavirus vaccine third dose oral 5 drops orally. Pentavalent 3, pentavalent third dose, intramuscularly 0.5 ml anterolateral side of the mid thigh. Then coming to pneumococcal conjugate vaccine PCV second dose, intramuscularly 0.5 ml anterolateral side of the thigh. Then coming to fractional injectable polio virus 2. Intradermally it will be given on the upper arm right side, 0.1 ml. 9 to 12 months of the age, we will give measles rubella vaccine, and it is given subcutaneously, 0.5 ml, right upper arm. It is MR1. This is called as MR1, measles rubella vaccine. When we say MMR is not covered under national immunization schedule. So that is measles, mumps, rubella. So MR is covered under national immunization schedule, and MMR is a paid vaccine. MR is a government scheme vaccine. It is given subcutaneously, 0.5 ml, right upper arm. Now for measles, I want to tell you, measles is a live attenuated vaccine. Coming to the next, pneumococcal conjugate vaccine, booster dose. See, we have already given 3 doses, now booster dose. Intramuscular, 0.5 ml, anterolateral side of the mid-thigh. Then comes 9 to 12 months mein we will give Japanese encephalitis vaccine 1. For this vaccine, I will talk at the end. Now coming to 16 to 24 months of the age, the vaccine which is given is MR2, measles rubella vaccine 2. It is given subcutaneously, 0.5 ml, right upper arm. See, measles vaccine जो होती है, इसको हम हमेशा subcutaneously देना होता है, इसको डिस्टिल्ड वाटर में, स्टेराइल वाटर में डिजोल्व करते हैं, और जो BCG वैक्सीन है उसको हम नॉर्मल सलाइन में डिजोल्व करते हैं. The content is BCG vaccine comes in the powdered form, and we dissolve it in normal saline. It is freezed powdered form. No, measles is a live vaccine, and it is given subcutaneously, and this injection is dissolved in the sterile water. Now coming to DPT. Now come DPT booster dose 1. See, now coming to the DPT booster dose, diphtheria, pertussis and tetanus. It is given intramuscularly, 0.5 ml, anterolateral side of the mid-thigh. Now coming to oral polio vaccine booster dose. See, at 16 to 24 months of age, we will give OPV booster oral polio vaccine, 2 drops orally. And Japanese encephalitis, I will tell you later. Now coming to 5 to 6 years of age, in this we will give DPT booster 2. So intramuscularly, 0.5 ml, anterolateral side of the thigh. Then when the child is 10 years of age, we will give TD, that is tetanus and diphtheria vaccine, intramuscularly, 0.5 ml, upper arm. When the child is 16 years, again we will give vaccine TD intramuscularly, 0.5 ml, upper arm. Now coming to the Japanese encephalitis. See, Japanese encephalitis have got 2 doses which are given in a selected endemic districts of Uttar Pradesh. Now first dose is given at 9 months completed, when the child is completing 9 months, and from 9 months to 12 months this vaccine is given, the first dose. Then coming to the second dose, it is given at 16 to 24 months of age, and the dose is 0.5 ml subcutaneous. Live attenuated vaccine है, it is given on the left upper arm. इसमें जो वैक्सीन का जो स्ट्रेन है, that is SA1414-2. This can be an MCQ question, that Japanese encephalitis का जो strain है, which is live attenuated vaccine strain, what is that? That is SA1414-2. Now coming to the vaccination in pregnant women. Now whenever we are vaccination of pregnant women, according to the recent national immunization schedule, the vaccine is TD, not only TT. The vaccine is tetanus and diphtheria vaccine, which is given intramuscularly, 0.5 ml, upper arm. It is given in early pregnancy, like it is given in the end of the first trimester, like 3rd month of pregnancy or 4th month of pregnancy. And the tetanus diphtheria vaccine, second dose is given intramuscularly, 0.5 ml, on the upper arm after 4 weeks of the first dose. तो जैसे ही फर्स्ट डोज का 4 वीक्स हो जाता है, उसके बाद सेकेंड डोज दिया जाता है. नाउ इफ़ द वुमेन इज़ प्रेग्नेंट within 3 years of the second dose, then she will only receive the TD booster dose. She will not receive again the 2 doses. She will receive booster dose of TD if received 2 doses in pregnancy within the last 3 years. So now she will only receive the booster dose, which is intramuscularly 0.5 ml upper arm. Now coming to the vitamin A prophylaxis, the purpose of vitamin A prophylaxis was कि whenever the mothers are bringing their children or parents are bringing their children for immunization on the mass level, so they will come to the community health center or the primary health center or the institution where the vaccination is done. There that all the children are coming, so they can do mass prophylaxis against vitamin A deficiency. So they used to give vitamin A first dose at 9 months completed along with measles rubella vaccine, तो उसको orally पिला दिया जाता था. Now dose is 1 ml, that is equal to 1 lakh international units. And vitamin A second dose was given at 16 to 18 months, that is also 1 lakh international unit orally. Then one dose every 6 months up to the age of 5 years. From second dose to ninth dose, vitamin A is given 2 ml. See, that is 2 lakh international unit, and it is given orally. This is to prevent the night blindness and to prevent the vitamin A deficiency in children during the growing age. Whenever children are coming for vaccination with their parents to the centers, this was the way we can cover this deficiency. Thank you so much, viewers. Like, subscribe and share.